Hey everybody, well welcome to today's Lunch and Learn. Today we have Dean Zelli with Advantage Administrators. He's going to talk a little bit about the flex spending accounts and the use of a mobile app for you to access your account information. So,
Thank you. Appreciate you having us here today. Your plan actually started January 1st, so this is kind of a review of some of the things that are part of it, but it goes to the 31st of December. You can make changes during the plan year if you wish. There's special enrollment, the family status change, so if you have substantial change in coverage of your insurance, if you're on your spouse's insurance, and for some reason you lose that insurance, you can flip over to add to your FSA account, or a birth or adoption or a death in the family, you can change your flexible spending in the middle of the year. You have to re-enroll each year, just like you do on insurance. It's a federal regulation that has to be done every year. You have two different plans here at the hospital. Your first choice was an HSA plan where your health savings account is at your bank, and the maximum that you can put on a single plan pre-tax is $33.50, or if you have a family plan, $66.50. That's from all sources because the hospital gives you 30 per pay period. So you can add all your own money to that if you wish as a pre-tax savings account. In exchange for exposure to more expenses, your premiums are a little less on an HSA plan. And you can still do a limited flex with an HSA. You just can't use it for medical or prescription. So if you have the HSA plan that you've chosen, and there's roughly 200 of you that have, you can still do a limited flex where you can do your dental or vision expenses. So that way you can save your HSA funds for medical or actually build the savings. The other plan is a traditional Choice Plus, which is traditional full insurance. And the hospital is putting $750 towards a contribution of an HRA. The HRA is a health reimbursement account, and that is for your deductible. So if you chose that plan, the hospital puts $750 in an account with us, and as you get your EOBs from United Healthcare, get those to us so that we can reimburse your deductible amounts. So if it's $100, send it to us, you get your $100. If it's $200, whatever the amount is, up to the $750. And those are for services that are done here, by the way. Some people are a little confused on that. They have to go to Covenant for something, for example, or if it's an emergency and they're out of town, those are for services here at the hospital. The enrollment, that's what the form looks like, but you guys do it all online. So the 1, 2, 3 brochure is over here. Grab one of those because that gives you all of the things that are eligible to run through your flex. And it also has a section in there in the health for the dependent cares also. So make sure you grab one of the 1, 2, 3 forms because that tells you all the eligible expenses that you can have. Plus we have it on our website at advantageadmin.com.
okay. Guess I wasn't supposed to grab it yet, huh?
No, it's fine. Go ahead and grab them. Just for a review on how a flex account works, I've got a short little video here.
Having a solid healthcare plan to fall back on is reassuring. But when expenses that aren't covered by your health plan add up quickly, it knocks your comfort level down a few notches. With a flexible spending account, out-of-pocket healthcare expenses are covered with pre-tax dollars. That means what you contribute to your FSA is reduced from your taxable income, giving you a significant tax break. And an FSA doesn't just cover out-of-pocket healthcare expenses either. You can put money aside for daycare expenses with a dependent care FSA. So you're covered on all angles beyond healthcare. And because it's all with pre-tax dollars, you're saving yourself a pretty penny. With an FSA, your funds are available 24/7, giving you the luxury of accessing your account information, transactions, and contributions online, or with your prepaid benefits card. For more information on signing up for your flexible spending account, contact your HR provider today.
The Health FSA, or Flexible Spending Account, some people call them Section 125, Cafeteria Plan, it's all the same thing. But the federal limit this year is $25.50. That's the most you can put in pre-tax. Those funds are available immediately. So if you chose that, to put $2,000 in, for example, on an enrollment last year, January 1st, you had that money available. So even though payroll hasn't run through yet. So let's just say January 2nd, you needed $2,000 for some kind of procedure that your insurance wasn't covering, those funds are available immediately. So what happens then is during your payroll through the year, it gets funded back up to zero from the hospital. So those funds are available immediately, and they can be used for anyone in your family, you, your spouse, or your children. So they don't have to be specifically for you. Your plan has a 2.5-month grace period, and how that works is basically instead of a 12-month program, it's 14.5. So you've got till March 15th of this year, for example, to turn in claims for last year's plan. So if you haven't used all your funds, you got an extra 2.5 months to use those funds up from last year's plan. Because funds you don't use, you lose. So you want to, take the chance. Don't take the chance in losing any of that. So you've got until March 15th, which is next week, for any claims that you may have had from January or February or so far in March, if you've got funds left that you haven't used yet. Those expenses can be used for medical, prescription, dental, vision, and like I said earlier, for any family member, spouse, children, anybody in your IRS family. The Section 125 is actually a section of the IRS code, so however you do your taxes is how you can use the flex. So if you've got one child, if you're divorced, for example, you have one child in your taxes and another one on your ex-spouse's taxes, you can only deduct the one that you have on your taxes. So just be clear on that on split families. The dependent care flexible spending account, if anybody has a daycare bill, they should be using DCAP, because anybody that's got a daycare bill knows that $5,000 doesn't touch it, but at least you can get it done pre-tax. So, for example, in Iowa, the average is like 25.6% tax rate. That's state, federal, FICA, and Medicare tax all combined. And so if you put in $400 per month, for example, it only costs you $300 in pay, but you have $400 to spend towards your daycare. So anybody has any out-of-pocket expenses that are not covered by insurance or your HRA plan, make sure you're using your flex and dependent care, because it's all pre-tax. Anytime you can pay a bill pre-tax, you're a lot better off than paying it post-tax. Several different ways you can file claims. Most people do them via email, which is that's fine. However you want to do it. You can fax them to us, you can mail them to us, and in a little bit I'll go over the mobile app, which is even faster than all the others. So I'll show you how that works. To file a claim, you got to make sure the substantiation is there. So if you have one that's turned in and you made a photocopy of it, make sure the date is on there, make sure the amount is on there, and who the services were provided, the carrier, and then the person that actually got the services. The IRS is real particular on us being the gatekeeper of the IRS pre-tax money, and there's certain things we have to make sure that are on each claim before we pay them. So we may turn it down and give you the reason why, and then just retake the picture or refax it or whatever so we can read what is actually on there. We process our claims every single day. So if it's into us by noon, it's processed that afternoon, and then the ACH will be initiated the next day to go back in your checking account, or the check issued the next day. So we don't sit on them like some companies do, do it once a month or twice a month. We do ours every single day. And that's also true with your HRAs. There are quite a few of you that use the debit card, and there's a brochure there explaining that. So let's just say you go to the doctor, it's a $20 copay, and you've got your flexible spending account set up. You just go ahead and run your debit card through to pay the doctor, and it comes out of your flex. If it matches your plan, and Angie's given us all the parameters of your plans, you're done. You don't have to do anything else. If you go to the eye doctor and your bill's $123.23 or whatever the dollar amount is, go ahead and run the debit card, pay the doctor, and then you'll get an email from us, hey, what's the $123.23 for? We need a receipt. And I'll show you in a minute how you can submit that to us for payment, but we have to make sure that it was a legitimate expense. Health savings account, you guys do have an HSA plan. I'll go ahead and run through this and kind of how they work. There's one mention in here about an investment feature. The bank you guys are using is working on an investment feature right now. When we get all the details on that, we'll let John Monahan know so that he can talk to you guys about it when it comes to enrollment. But it sounds like it will be ready this fall. And how that works is you get to a certain dollar amount, you can invest it in mutual funds and that type of thing to get your account to grow faster. And those are also tax-free. So if you have $10,000 in your account, for example, and you put $4,000 or $5,000 in an investment account, and it makes $200 or $300 or $400 a year, that is tax-free income also for you. And those funds can also be used for retirement down the road, or you can use them for your medical expenses now.
Here's your health savings account. Funded with tax-free dollars, it's a smart way to pay for items not covered by your health insurance, like co-pays and prescriptions. And even though your employer can contribute to your HSA, if you leave your company, you take it with you. If you have money in it at the end of the year, it rolls over. And once your balance reaches a level set by your employer, you can invest in the market and grow it more. And get this, once you hit retirement age, you can use your HSA for anything, even if it's not healthcare related. That means when you make regular contributions, even small ones, you're saving for retirement. So when you're offered an HSA paired with a qualifying insurance plan, don't turn it down. The savings will surprise you. If you aren't offered one, talk to your employer about providing an HSA option. Quick online enrollment, combined with a benefits debit card, anytime, anywhere, retrieval of account information, and the best mobile app in the industry simplifies the business of healthcare for both of you.
We won't have more information on your bank as far as the investments and how that works. Either us or John will go over that with you and how that all works. It's a pretty slick feature. We have another bank we use, and it really is nice where you can have those funds grow a little faster, especially if you're young and you plan on using an HSA as an investment tool for retirement. Once you reach retirement at 65, you can pull those funds out without penalties. And you can pull them out at any time for anything that you want. You just have to pay the taxes. So let's just say you get up to $10,000 in your account, you buy a house, you need down payment. You can pull those funds out. They're yours. But you will have to pay taxes on those. You'll get a 1099 from the bank, say, hey, they pulled out 10 grand that was pre-tax, here's your bill. So you'll have to file that with your taxes and pay your taxes on that. But they are your funds. You can use them for anything. If you use those funds for medical, then you don't have to pay the taxes. So they go in tax-free, they're spent tax-free, so it's all before taxes are pulled out. So it really makes your dollars stretch. As far as reimbursement, the benefit card, we kind of talked about a little bit, and I'll go in a little more detail on how those work, because about a third of you are using the Benny card. Most people either get a check or direct deposit. The direct deposits are the fastest way to get the money back into your account. Like I say, we initiate the ACH the following day, and it should be, depending on how fast your bank is, and if it's in Iowa or out of Iowa, it will take 1 to 2 days to get it into your account. But, or we can do it the old-fashioned way, cut a check and mail it to you. As far as the HRA reimbursements, make sure you turn your explanation of benefits in from United Healthcare to us so that we can have that information to get you the money back out of your HRA that the hospital has provided.
With your health being your #1 priority, it's important to keep healthcare expenses in check. But that's easier said than done. If they were managed conveniently with a single solution, things would be simpler. Now they can be. With tax-free dollars on your prepaid benefits card, you can pay for out-of-pocket healthcare expenses right at the point of service. So you don't have to dig deep when it's time to settle up. With your prepaid benefits card, you can pay directly without having to file a claim and wait for reimbursement. It allows you to have multiple accounts all in one convenient place so you can avoid paying twice, through payroll deduction and then at the point of service. And if you get a bill for out-of-pocket expenses, just write your card number on the back of your balance due bill and send it in. It's that simple. Simplify your healthcare expenses. Contact your HR provider today for more information.
You get 2 cards per account. So if you got a spouse, you got one in their wallet. If you've got a child off to college and they're also in your account, you can get a third one if you wish. There's a $10 fee on that. Most of your Benny card purchases are automatically verified. There's a system called IIAS, which is Inventory Information Approval System, that the major chains are all part of. Walgreens, Target, Walmart, that type of thing. If you ever looked at one of your receipts, like if you go to Walgreens and get some things, there's a little star, and then sometimes there's an RX. Those are things that are eligible to come out of your flexible spending account. So they already automatically do that. So if you go get a prescription and a greeting card and a gallon of milk at Walgreens, run your debit card, it'll pull your prescription out, and the rest will show as a balance due. It's a smart card. It knows what you can take out and what you can't. And things that are automatically verified, you don't have to send a receipt on that. You won't get an email from us. If you go to a mom and pop pharmacy that's not part of the system, then you'll just have to substantiate the receipt like you would normally. Additional substantiation is always required if you go to the doctor, or eye doctor, or the dentist, because those are not part of your plan, and those dollar amounts will be different for every service. Federal regulations require us that within 60 days you have to have substantiation to us, or we have to shut it off per IRS regulations. So if you get an email from us, and you'll get several of them, hey, we need a receipt, we need a receipt, we need a receipt. After 60 days, your card won't work anymore, and then you'll call us and say, well, why isn't my card working? Well, we needed this receipt. So get it to us. We can turn it right back on again in our office. But federal regulations require that we have to shut those off after 60 days. You are responsible for all transactions to be verified if they're not automatically done. It's an IRS requirement, even though you have a cafeteria flex plan, that you keep all your receipts. If you ever happen to have a personal audit, they're going to know you had a cafeteria plan at work because it's all set up with the IRS. They're going to want to see those receipts and reimbursement. So we've got some envelopes over there for your medical receipts. Anything you're running through Flex or anything you're turning in your taxes that's not part of Flex, there's an envelope over there you can put all your receipts in. So make sure you give us an email. You can go into your account anytime at advantageadmin.com, and I'll show you the logins here in a second. And update it with an email address. That's the fastest and quickest way for us to communicate with you. The online portal, I'll show you the login in a second, but you can verify your accounts, you can update things, but when you log in, you'll see this. It's advantageadmin.com. You click on My Flex, and the username and password I'll show you in the next slide on how you get that. But if you have a dependent care and a health FSA, they will both be there. Your HRA is separate. It's not part of your cafeteria plan, so there's a separate login on that if you want to see where your HRA funds are. But you get notices from us anyway, how many dollars you've used and what's left. But to log in, you're advantageadmin.com. You click on the employee login icon, MyFlex, and the username and password is the first initial of your name, your last name, the plan number, and the last four of your social security number. So I just threw mine up there. It's DZelli. Your plan number 53 here at the hospital. We've got 700 and some plans, so it's an old plan. We've had it a long time. And then the last four of your social, and then the password is Star Flex Plan. As soon as you hit that, it's going to take you to another screen where you're going to have to verify, you put in some security questions and change the password. It won't let you keep that one. You'll have to change it immediately. And if you've done that once and forgot what your password is, call us. We can reset it for you via your emails. But you'll have to change that immediately as soon as you log in. There's about 100 of you that have a flex plan, and as a couple of weeks ago, only about 30 people have logged in. So if you want to know what it looks like and all the stuff that's in there, make sure you log in and you use it. You get a monthly email from us about account balances and transactions, and this is new that just started about a month, maybe 2 months ago. You can get a text instead of emails if you wish. Verizon and US Cellular have set that up, and there's other carriers that are going to be done soon. We have a new release from our software company, and it sounds like there's going to be 2 or 3 more carriers. I know AT&T is coming on soon, and so is Sprint. But the 2 big ones in Iowa are Verizon and US Cellular. They already are set up on the system, so you can get a text from us instead of emails if you wish. But we'll have to have your phone number, and that's all in your profile on our login. Okay, the mobile app. Quick little video, and then I'm going to show you actually on my phone how this works. It's really simple and easy to turn in claims.
Our Benefits mobile app makes using your health benefit accounts easy. Log in and you immediately see your available funds, broken down by account. Click to see all the details, balance info, account activity, and more. Ready to file a claim? Just take a picture of the receipt and upload it from your phone's camera. No fax or computer is necessary to substantiate your claims or card transactions. And asking a question is as easy as clicking a button. Contact us and try it today.
Okay, those are free apps. You can get it at Google Play or at the App Store at Apple. It's good for Android phones or Apple phones. I happen to have an Android here, but It shows up as a little icon. It says one plan. Just click on it. You can tell them what PIN number you want to use, and it will pull up your accounts. I should have 2 showing here, yeah. My 2014, I just cleaned that out. That's at 0, and there's my 2015 account. So if you want to file a claim, you just hit File a Claim, tell which account you want to pull it out of, and then you basically just answer the questions. You know, who was the provider, what was the dollar amount, what was it for, you know, medical, dental, vision, or whatever, so we can categorize it with the IRS, the dollar amount, and which family member received it, and then miles driven. People don't realize that you can deduct mileage on your Flex account. This quarter, I believe it's 23 cents a mile. It changes quarterly from the IRS, but I believe it's 23 cents a mile. So if you have to run to Rochester or Iowa City for a specialist, 23 cents a mile, that can come out of your Flex. Then when it's time to upload a receipt, you just upload a receipt, turns the camera on your phone, line up your receipt, take a picture of it, hit submit, you're done. You don't have to fax anything to us, you don't have to email anything to us. And that's really slick if you're at like the dentist or the eye doctor or something where you get a bill immediately and you can do it and turn it in immediately. Or if you get your EOB from United Healthcare, you can do the same thing. Just take a picture of it, just make sure everything's in there. And it lets you look at the picture before you send it to make sure your thumb's not over it like I've done. So it's pretty slick. It's really easy to use. And most people are using smartphones these days, and most people have them with them all the time. So I don't know how many times we've had someone, yeah.
I'm just wondering, does it save a copy of that receipt then, like in a folder to show that you submitted it?
We save it on our server.
Save it. So you still need to keep the hard copy. It's
Yeah,
not
you
like
still
it's-
need it for an IRS
Yeah.
audit, but once anything you submit to us, either via internet, hard mail, or online through your smartphone, is on our server. We have to keep those records for 11 years. So they're available. So for some reason you have you get all of a sudden you get audited for 2010. Say, oh man, I don't know where that stuff is. Anything you've turned into us, we can get you. I mean, give us a little time because we have to print it all off, but it is available for us. It's on our server. But the mobile app just makes turning those claims in so much easier. I don't know how many times people have told us, well, I had a receipt at Walgreens, but I can't find it. Or I put it in the car and husband cleaned the car out and it's gone. Just do it immediately. Take a picture of it, send it in. It's just a lot easier to do it that way. Front of mind, a lot easier. End of year deadlines on your HSAs. Those of you that have those, there is no end of year deadlines. An HSA can be used anytime for any purpose with your medical. For flexible and dependent care, you have until March 15th to incur your expenses. That includes daycare. So let's just say you put $5,000 aside and forgot to turn the claims in. You still have until March 15th to do that yet for last year's plan. And then there's a run-up period. So the run-up period goes from the end of your plan, which is the end of December. You have 90 days to turn claims in. So you can incur expenses till the 15th of this month and then turn them in by the 31st of this month for last year's plan. So, and that will be true a year from now. So you'll have till March 15th to incur your 2015 expenses, and you'll have until March 31st then to turn them in, March 31st of 16 for the 15 plans. All claims for services must be submitted by the state for your 15 plan. Any funds that you have left that you haven't spent will be gone. Now, we do have on our website, advantageadmin.com, there's an FSA store. So let's just say you've got $30 left and you don't want to lose it. Go into the FSA store, buy first aid kits, Band-Aids, gauze, breast pumps, crutches, there's all kinds of stuff. Whatever you can deduct in your FSA, you can purchase through the FSA store, and those funds would come out of your Flex so you don't lose them. Oh, one thing, DCAP and FSA funds do not roll over to the next plan year, especially on daycare. Most people use up their daycare funds because you can only put $5,000 in there. But make sure that you use those up because they don't roll over to the next plan year, which is different than your HSA. Same thing with your HRA. If you don't use those funds, they were hospital funds anyway, but if you use 700 of it, the others goes back to the hospital. Kind of went through things quickly because you guys have been on the plan for quite a few years, but any other questions at all I can answer for you?
Can you just quickly explain, and I know this is a federal thing, but the rationale of $5,000 a year for daycare? I mean, so if you have one child or 4 children, it's I guess the history or why that decision, or if you know that.
That's a good question.
Okay.
And I have asked Senator Grassley that exact same question, and he couldn't answer it either. It's all legislative. They're looking at, I'm sure they're looking at budgets. You know, if they allow you to put 10 grand aside for daycare, that's 10 grand they aren't getting taxes on. And I think the 5 grand was just an arbitrary number that's supposed to be indexed but hasn't been. But there's a move in Congress to get that indexed just like the flex. Because last year, right in the middle of enrollment, in the middle of 2013 enrollment, it went from 2,500 to 2,550. It was too late for a lot of people to implement the extra $50. Everybody think, well, $50, woohoo! But it's based on the IRS and it's indexed based on inflation. There is movement in Congress to change the DCAP. How far it's going to get, I don't know. But there's some talk, because you're right. If you've even one child, 5 grand does not touch taxes. The nice thing is you can do it pre-tax now, and then anything over the 5 you can still deduct on your income taxes. So if you had a $7,500 bill, you can still put $2,500 on your taxes, but you're a lot better off doing it pre-tax, because that rate is a lot bigger savings than what most people are as far as the tax bracket, especially when it comes to the state of Iowa. But yeah, anytime you can do that pre-tax, you're much better off. You know, as far as anybody has a daycare bill, they should be using DCAP. Anybody has out of pocket, they should be using flex, because it's all pre-tax dollars. The government's got enough money. Well, let's keep as much as we can in our pockets. So.
I've got a question.
Okay, go ahead.
Would there be a benefit to doing the HSA and the FSA? Because, like, I don't have any children in daycare or anything anymore. So really the only thing that we worry about is, of course, medical bills at this point.
Yeah, the
Or would you just stay
HSA.
with HSA?
Yeah, HSA is designed for medical and prescription. So if I see you have glasses, so that was something that you could do a flex through.
Right.
So you would have your tax advantages there. But if you're maxing out the dollars that you're using, let's just say if you're on a husband-wife plan and you're putting $66.50 in there, use those for vision also if you want to.
Right.
But some people are using the HSA as an investment tool, and they're trying to get it to grow as fast as they can. So then they do a limited flex for the dental and vision. So usually there's not a lot of expense there, but if you want to set aside $500 a year, for example, that's $500 that you could leave in your HSA drawing interest. Especially if we get to the point where the bank has an investment feature where it will grow faster. Because some of those mutual funds in the last couple of years have grown 10, 15%, which is a lot more than the 2/10 you're going to get just laying there as a savings account. Yeah.
Just to confirm, and I think I already know the answer to this, but the dependent care account, that's just $5,000 per household. It's not per...
Right. That is, it was on the screen, I didn't talk about it, but the $5,000 is the limit per family unit. So if your husband or spouse has a account at his business or her business and they put $3,000, that means you can only do 2, or vice versa. But the two of you combined can only total $5,000 or less. Now it's a little different with a flex. You can both do a flex. You can do $2,550 and spouse can do whatever their limit is. That there some places limited how much you can put in, but you can do both. So, and then you could use up one fund and then use your funds, or you can use them together. However, if you got a large family, you may want to both consider doing flex, but because those funds can be used in anybody in the family. So you can both have a flex, you can both pull off of it, and the DCAP is a $5,000 max per family unit. And we've had that question a lot about when's it going to raise, when's it going to raise. We don't know. It's up to the legislature, or to Congress. And as slow as they are on some things, it may take forever, but there is movement for that to be changed. And just as a side note, the IRS has hired 10,000 enforcement agents, and they are out looking for stuff. So just keep all your records just to protect yourself.
How far back can they go? How many years?
That's changing also. It used to be current 3, now it's current 5.
Okay.
We're current in 7, but we have to hold the records for 11, so it's whatever arbitrary number they come up with. Sometimes you swear they just pull them out of the air and that's what it's going to be, but there's no rhyme or reason sometimes of what they're doing. And the IRS is sometimes interpreting law different than the Department of Labor, so we're trying to do both things together, worst case scenario for our clients, so that we know where we're at. Department of Labor is more hospitals concerned than yours, but in case of an audit, just make sure you keep all of your records so that you've got everything. Any questions on the mobile app? Oh,
Did you say you can submit for reimbursement on the mobile app for dependent care?
yes. That is a change that is happening this weekend.
Oh, okay, sorry.
I was talking to you about some of the stuff that was changing. The decap right now you still have to do on our website, but as of the new update that we're getting, you'll be able to do it. And it'll change when you do your mobile app. When it updates your mobile app, it'll have the new stuff on there.
Perfect.
And I don't know how they're going to do the signature of the daycare provider yet. I haven't seen that information. So I don't know how they're going to do that.
Because like ours, she signs her invoice.
Is there a time frame on when we can sign up for this?
Well, we have annual enrollment in November.
Okay.
Or unless you have a qualifying life event.
Qualifying
Okay.
event now.
Okay.
Yeah, dependent care depends. Those funds are available as you put them in. So if you're putting $400 a month in for your dependent care, you can pull $400 a month out. Some people let it build and just do it once or twice a year or once a year for vacation or Christmas money. It's totally up to you how you want to do it. But just remember on the dependent care, those funds are only available as you put them in. Any other questions? Got one of my cards there. If you do, just give me a call. I'll be glad to help you out. I answer my phone unless I'm with a client or sleeping. So. All right. Thanks for stopping.
Thank you.